All right, good afternoon. My name is Myle Atkins. I'm a PGY2 at Rush. And like I said, I'm talking about risk factors of subchondral insufficiency fractures of the knee in the setting of medial meniscus posterior root tears. Nothing to disclose. The meniscus, as we know, is important for biomechanical integrity, stability, as well as joint preservation. Tears of the meniscus can lead to a loss of hoop tension, which can lead to increased tibiofemoral contact pressures. Specifically, subchondral insufficiency fractures of the knee is a relatively new topic. The thought is that stress fractures that occur when repetitive and excessive stress is applied to the subchondral bone. If the fracture does not heal, this lesion can develop into osteonecrosis and result in osteochondral collapse. In the systematic review of the role of the meniscus in the development of this osteonecrosis, it was found that in 81% of cases, meniscal root tears were associated with its etiology. The thought is that meniscus tears lead to the increased contact pressure, which create an environment from which insufficiency fractures can emanate. This can result in knee pain, osteoarthritis progression, and it shows that it's a conversion to arthroplasty rate at about 30%. There are many risk factors associated with this disease process. Thoughts are that meniscal extrusion, duration of injury, age, as well as tibial slope are all risk factors for CIFC. However, the studies that study this have a small sample size and restricted consideration of factors. So the purpose of our study was to identify the risk factors for CIFC in patients with medial meniscus posterior root tears. We hypothesized that age, BMI, the extent of the meniscal extrusion would be significant risk factors. As far as our methods goes, it was a single institution retrospective review. Data was collected from 2017 and 2021. We included patients over the age of 18 who had isolated medial meniscus posterior root tears and had an available knee MRI, and we excluded patients with concomitant ligamentous injury, concomitant meniscus injury, or history of ipsilateral knee surgery. We then divided into two groups, those who had the insufficiency fracture and those who did not. We looked at both x-rays and MRIs. On the x-rays, we measured the KL osteoarthritis grading system, and we also measured joint space using the midpoint method, which measured from the tibial spine to either the medial or the lateral tibial plateau. We also used this described classification system for subchondral insufficiency fractures, looking at grade 1 through grade 4 lesions. The grades are listed above. Grade 1 and 2 are low-grade lesions, and grade 3 to 4 are more described as high-grade lesions. Overall, we looked at about 153 patients were included. 60% did not have the insufficiency fracture, and 41% did, at a mean age of about 56, and about 72.5% were female. Overall, our data showed that prior ipsilateral knee ejection, tibiofemoral joint space, and meniscal extrusion were all statistically significant as far as what in the CIF group compared to the non-CIF group. As far as our distribution of different lesions, location was mostly on the tibia side. CIF grade in the tibia was grades 1 through 4. However, we were unable to find any high-grade lesions in our group. And in the femur, we were unable to find type 4 grades on only 1 through 3. Did a multivariate analysis and showed that joint space was the only significant risk factor which led to these patients having this increased risk of the fractures. A receiver operating characteristic analysis conducted to determine the threshold for tibiofemoral joint space, and the under the curve was 76.6%, and the predictive threshold was tibiofemoral joint space of less than 3.93 millimeters was an increased risk factor for developing these fractures. So overall key findings was decreased tibiofemoral joint space was a significant independent risk factor for developing subchondral insufficiency fractures of the knee. Several limitations of our study is that it was a cross-sectional study, retrospective design. We had the absence of bone density and metabolic markers, which could lead to confounding factors. We had a limited number of patients with grade 3 and grade 4 lesions, and we only had a predominance of middle-aged females, so our results may not be generalizable. As far as the future directions goes, we would like to look at and confirm the risk factors for this FISC, specifically meniscal extrusion, and we wanted to determine the optimal management and timing to implement as far as management for these patients. So overall, our final conclusion is that CIF development is multifactorial. Decreased tibiofemoral joint space is a significant independent risk factor, and there's a greater risk with joint space less than 3.93 millimeters. Thank you.